from Tripod Fertility, here to discuss. So Fred, what would you like to talk about for these cycles and the difference between them?
So we have a lot of patients, Melissa. Thank you, first of all, but we have a lot of patients who inquire about natural IVF cycles or even mini stims or what we call modified natural cycles versus stimulated cycle. And I think you can put in the same category natural and modified natural cycles, and in a separate category, the mini stims and the stimulated cycle, which are both a stimulated cycle. And so when patients approach us, some of them know what it is, some of them don't know exactly what it is. And I explain to them the difference between a natural and modified natural. So the natural cycle is a cycle where you wait until a woman's body spontaneously stimulates the ovaries and therefore recruits one or sometimes two in the case where you're going to have twins, or if you're going to have triplets spontaneously, then three, but that's not very common. But recruits the follicles naturally. And in the case of a completely natural cycle, we also wait until there's a natural endogenous LH surge, which is going to make the patient ovulate. And then it becomes a little bit of a estimation game, because because we do blood work once a day, we have to assume that we're going to fall within the window where the LH surge has been long enough to allow us to collect an egg that is mature, but not too long so that the patient doesn't ovulate before we get to the egg collection part of it. The modified natural IVF cycle is one where, because we don't want to miss the ovulation, we give 1 or 2 days of a medication that blocks ovulation. And that allows us not to miss it. And because we give that, we also have to give 1 or 2 days of a very low dose of hormone. And that will keep the follicle growing. And that allows us to time the trigger of the ovulation so that when we go get the egg, we know for sure that it hasn't ovulated. The by opposition, stimulated cycle is a cycle where the patient will take gonadotropins or hormones to stimulate the ovaries from the beginning of our cycle until the trigger day, or the day that we trigger the ovulation. Um, the so when you look at them in terms of the cycle itself and what the patient needs to do, the difference is that one of them is much less invasive in terms of the amount of medication, and that's the natural cycle, or even the modified natural cycle. It's much less medication, but it's also less, well, in a patient that has the same. So for example, if you take a patient who's 30 years old who has 10 eggs, well, a natural cycle will yield one or maybe two eggs, no more. So it's less eggs, less invasive, most definitely less costly also. But at the same time, at the end, we have less eggs, therefore less embryos, or a likelihood of less embryos. A stimulated cycle will give you more eggs. It's more invasive in the sense that there's more medication, more injections. Doing the egg retrieval is a little more invasive also. But there is a likelihood of having more embryos, or there's more of a likelihood of having embryos. And so that's the difference between the two, roughly, in terms of how you do them.